Hi there. Good morning, good afternoon, good evening, whatever time it is. As always, happy whatever day it is that you're watching this, and welcome. I'm Larry Erickson. This is the Erickson Report. And we start this time right out with another instance of our occasional feature called A Longer Look, where we go into something in somewhat more detail than we usually do. In this case, it's a longer look at healthcare. The experience of COVID has generated warnings among health experts that we as a nation are no more prepared for the inevitable next pandemic than we were for this one. Those folks are usually thinking in terms of stockpiling medications and other equipment and distribution mechanisms for them in a time of need, along with better tracking once some new virus does inevitably crop up, the better to contain any outbreak that might result. But there's another issue, less often discussed, but just as important. The experience of COVID has laid bare the fact that the very nature of the healthcare system in the United States is broken. It needs overhaul. It needs massive restructuring. The failures, delays, wildly varying responses, the erratic and fragmented treatment efforts, and the gross inefficiencies that together cost tens, if not hundreds of thousands of lives over the past year. An outcome that has not really revealed, but what it has done is it's put an exclamation point on the fact that we actually don't have a healthcare system aimed at maximizing health. We have a healthcare industry based on maximizing profit. In the words of Bonnie Castillo, she's an RN and she's the executive director of the National Nurses United Union. Quoting her, "The pandemic has highlighted in deadly detail what nurses have known for decades. Our current healthcare system is a colossal failure and leaves far too many of our patients to suffer and die unnecessarily." Now, how bad was that failure? A new report released March 16th by Public Citizen argues that the nation's coronavirus response was hindered, quote, "at every turn," unquote. Adding that, quoting again, "the reality is that our for-profit healthcare system put the U.S. at a dangerous disadvantage and hindered rapid response." That resulted, this report found, in millions of COVID-19 infections and hundreds of thousands of deaths that could have been prevented. Deaths, it must be noted, that disproportionately fell on communities of color, where people died at 3 to 5 times the rates of whites. And that, too, is a direct result of the unequal access to care that is another effect of our corporate-dominated, profit-driven system. The root of the problem here is that our access to health care, which is available on fee-for-service basis, our access to health care is mediated through insurance. Now, while Medicaid and Medicare and some other government programs do offer insurance, the way the vast majority of adults in the United States get health insurance coverage for themselves and their families is through their employer. That is, our access to health care is based on private profit-seeking insurance tied to our employment. Suddenly have tens of millions unemployed, as, for example, during a COVID pandemic, and you just as suddenly have tens of millions uninsured. People unable to pay for their health care, costs which can be crushing even if you just get a little sick, and can be difficult to cover even for routine care, even if you don't really get sick. And that leads to large numbers of preventable deaths. That Public Citizen white paper I just mentioned was built off a study released on March 4th from Families USA, which concluded that over 40% of U.S. COVID-19 infections and about a third of the deaths have been associated with a lack of health insurance. So by February 1st, this report noted, nearly 11 million COVID-19 infections and over 140,000 deaths could be connected to gaps in having health insurance. And even having health insurance might not be enough. The number of underinsured Americans, that's those who have some form of health insurance but can't really make good use of it because the copays and deductibles are so high, which leads to delayed or even avoided health care, that number of people is stunningly high. It's a quarter to nearly 30% of all U.S. adults are underinsured. Now, As a result of the Affordable Care Act, most particularly through the expansion of Medicaid, about 20 million non-elderly Americans have gotten health insurance that they didn't have before. But the combined total of uninsured and underinsured working age adults has remained the same at about 45% of that working age population. That's about 87 million people, because even as the number of uninsured declined, the number of underinsured rose. So we are now at the point where, according to a poll by Gallup and West Health released on March 31st, nearly 1 in 5 U.S. adults, that's nearly 50 million people, say they could not afford quality health care if the need for it arose. And the same numbers say that someone in their household has foregone care sometime over the past year because of that cost, with more than a third of those in low-income households saying that they have done the same. That's finally confirmed by a GeoHealth survey from last November, which found that a third of people below 65, 65 being the eligibility age for Medicare, that a third of people below 65 are planning to reduce preventative care or everyday household expenses in order to be able to afford health insurance. And this is all while 8 million Americans have started crowdfunding campaigns to try to pay for their medical care, crowdfunding campaigns that in vast majority of cases fail. This all is after 10 years of the Affordable Care Act, the thing that was supposed to solve the problem of access to health care. So look, if you want to say the ACA is better than what we had before, go ahead, so long as you remember that it's only by comparison, and better than we had is a damn low bar to get over. The ACA simply is not nearly good enough. Even though the U.S. spends more on healthcare than any other OECD country, and the OECD's the Operation for Economic Cooperation and Development, it's essentially the industrialized nations of the world. The U.S. spends more than any other OECD nation on health care. The fact is, life expectancy in this country has declined in recent years. Not that it was good before. According to the World Health Organization, the U.S. ranks 40th among the nations of the world in that regard. And even as life expectancy has declined, costs for consumers have continued to rise. According to a survey by the Kaiser Family Foundation, annual premiums for employer-sponsored family health coverage rose 55% during the first 8 years covered by the ACA. And the ACA, the bill's utter failure to challenge or impact that employer-provided corporate insurance model, a model that left untouched, in fact, endorsed and embraced, because the subsidies on the healthcare exchanges are essentially public financing of private profit. That failure meant that by its very nature, the ACA could not deal with the pandemic surge in required care, and people, lots of people, died as a result. Okay, so what's the alternative? What could have helped in the pandemic and would help in the future? Well, you already know the answer. Take the profit out of healthcare. And the biggest step we can take in that direction right now is what's known as single-payer health coverage, popularly known these days as Medicare for All. On March 17th, Representatives Pramila Jayapal and Debbie Dingell introduced the Medicare for All Act of 2021 with the support of 300 local, state, and national organizations and over half of the Democrats in the House of Representatives. It envisions a 2-year transition to a Medicare for All system that would also expand what Medicare offers to include dental, vision, reproductive health, mental health, long-term care, and other services, all of them with no out-of-pocket expenses involved, no deductibles, no co-pays, no private insurance premiums, and fewer hassles finding a healthcare provider because the issue of being in or out of network no longer applies. Polls consistently show that a clear majority of Americans, even nearly half of GOPers, favor a single-payer system, with overall support running from the high 50% to the high 60%, depending upon exactly how the program is described. Now, despite that, there's chances of Jayapal and Dingell and the rest getting this bill passed this session are actually quite slim, and we'll get to some of the reasons why later. But it's still a good thing anyway, good thing to do this. First, because it lays down a marker This is what we're after. And second, it provides leverage. Leverage which Bernie Sanders is already using in the Senate to push for amendments to the next reconciliation bill that would reduce the eligibility age for Medicare down to 60 and revoke the ban on Medicare negotiating drug prices with manufacturers. According to analysis done last April by the healthcare consulting firm Avalar, lowering the eligibility age to 60 could extend the program's coverage to as many as 23 million more people. Now, one important feature of a single-payer system is that it's both more efficient and simpler for consumers to navigate. There is a tremendous amount of administrative cost and waste in our current chaotic, profit-driven mess, with multiple insurance corporations negotiating with multiple providers using multiple sets of standards and levels of eligibility and multiple billing systems, all of which complexity disappears under single-payer. That's a big part of the reason why studies have repeatedly shown that a single-payer system costs less than we pay now. For example, in January of 2020, a team of analysts at 3 University of California campuses examined 22 studies on the projected cost impact of single-payer health insurance and found that every one of them, even one from the right-wing Mercatus Center, every one of them projected it would yield net savings over several years. The size of the savings varied with the assumptions made, including the exact nature of the program, but every one of them said it would mean providing comprehensive coverage while costing less. And there were more such studies to come. In February 2020, analysis done at Yale and published in the peer-reviewed medical journal Lancet found that a single-payer system could slash the nation's healthcare expenditures by 13%. That's more than $450 billion a year, while saving about 69,000 lives. In December of 2020, the Congressional Budget Office released its own estimate about the cost of implementing a single-payer program. The CBO considered 4 different single-payer designs and found that such a system, depending on the details, would save somewhere between $42 and $743 billion a year by 2030. The CBO option that most closely approximates current Medicare for All proposals shows savings of around $650 billion a year by 2030. And even if you add long-term support and services to that, it still shows savings of about $300 billion a year. One significant finding of this is that the administrative costs for Medicare, which are already just around 2%, a figure so low that during the debates over the Affordable Care Act, the insurance industry considered that unfair competition, that the administrative costs under a single-payer system would be even lower, not 2%, but more like 1.5% to 1.8%. And finally, for here, in a paper published in January 5th of this year, a team from Cambridge Health Alliance, Harvard Medical School, and the University of California, San Francisco looked at the relationship between universal health care and use of medical services. This is about the claim that universal access to care would lead to so many people using so much care that the system would be overwhelmed by user costs, swamping any administrative savings and making Medicare for All just too damn expensive. The team examined that claim and found it to be utterly false. The thing is, between 1973 and 2020, various models predicted utilization increases, that is, the increase in demand for medical services, of up to more than 21%. But this team looked at the actual history of past coverage expansions and found that the increases in utilization were actually quite modest. They found that nearly all previous predictions overestimated the impact. According to the author's review of the actual historical record, universal coverage would increase ambulatory visits by no more than 10% and hospital use by no more than 3%, while noting that modest administrative savings would offset those costs. So what all this comes down to, the bottom line of all this, is that a single-payer system provides excellent health care, a wider range of services, is easier for consumers to navigate, costs less, and has the support of a majority of the population. Which is why it is so incredibly frustrating and disappointing, even depressing, but I have to add not surprising, to note that the hierarchy of the Democratic Party, including Nancy Pelosi in the House, Chuck Schumer in the Senate, and Joe Biden in the White House, are all against it. Pelosi is actively discouraging House Democrats from supporting Medicare for all. Schumer says the Senate Democrats will go with what gets the most votes, which by definition in a divided Senate either means nothing or something sufficiently pleasing to the reactionaries. And as for Blodden, he said in May 2020 that he, as president, he would veto a Medicare for all bill. Now, in fairness, I will note that Blodden supports lowering the Medicare eligibility age to age 60. But in truth, I will also have to note that he only did that after it became so obvious that health care was such a significant issue in the campaign that he had to do something in order to soften his outright rejection of Medicare for all. So anyway, with this triumvirate of political turpitude, what this trio of twits wants instead of a single-payer system is some minor tweaking of the Affordable Care Act, the very thing that has had 10 years to prove itself and has instead demonstrated it is not up to the task of either universal coverage, cost containment, or emergency response. Their central idea is to create a government-backed public option health plan and expand Obamacare subsidies which again amount to public financing of private profit. And as for the public option, have we forgotten that such a thing was supposed to be part of the original Affordable Care Act? Is this truly the best the Democratic hierarchy can offer us? A promise to refight the battles of 10 years ago with the promise that this would, in the words of Senator Michael Bennet, who is a co-sponsor of a bill to implement Blodden's vision, that this would finish the work of Obamacare? A plan that would leave intact, indeed embrace, the very fractured, fragmented, profit-driven, corporate-dominated healthcare network that has been such a disastrous failure, particularly over this past year? Is that really the best they can do? And why? Why are they showing away from Medicare for all? Are they acting out of a timid fear of what the right wing might say about Democratic candidates in 2012? Because I know Nancy Pelosi is. Are they too tied to corporate interests to go against them? I know Chuck Schumer is. Are they thinking that Medicare for all is a slap in the face of their legacy? Because I know Joe Blodden is. Or are they just stubbornly unwilling to admit that they got it wrong? But why isn't really the point here? First of all, because all of that is true of all of them. And secondly, because it doesn't make a damn bit of difference why. What matters is the lives and the health will be lost as they repeat the blunders of 10 years ago. 10 years ago, the Obama White House didn't start going after the Affordable Care Act with a demand for what should be done, what Obama himself admitted should be done, expecting then to have to negotiate back from that demand to what would be the maximum that could get passed that year, with the idea of going back to it after that. Instead, they started with a call for what they thought would pass at the time without a whole lot of trouble, with the obvious and predictable result that they got even less than that. When during the bargaining over the Affordable Care Act, I complained about that approach, I was told, don't worry, let's get this through and we'll come back next year and make it stronger. And I called it because I said, no, you won't. You'll spend your time and energy trying to defend what you've got against being taken away. And that is exactly what has happened. So now, as Yogi said, it's deja vu all over again. The Democratic leadership resuscitates proposals from a decade past and says that with only a couple of tweaks and jiggles, we'll finish the work of Obamacare. And then if they do that, they'll happily clap each other in the back and talk of the great work they have wrought while tens of millions continue to suffer its failures. I suppose I could call that an outrage, but the truth is, it feels a great deal more like a tragedy. Time for a break. And here we are back. And we're back with, take up the rest of the show with our recurrent segment, 2 weeks of stupid, clowns and outrages. And as usual, we're going to start with the clowns. So last time out, in discussing the killings in Atlanta and Boulder, I mentioned that an impediment to Congress doing anything is Joe, I'm a responsible gun owner, Manchin. What I didn't note is how much of a clown he is on the issue. The House of Representatives passed 2 gun control bills in March, one of which extends background checks to all gun sales and transfers. It actually contains carve-outs for transfers between family members responding to an immediate threat or temporary transfer for hunting. But even that is not a big enough loophole for Mr. Responsible Gun Owner. He wants private gun sales between people who know each other to be exempt from background checks. So, in effect, we had the gun show loophole, we had the online loophole, now we can have the friend loophole. Can't buy a gun because you can't pass a background check? Just have somebody you know who can pass a background check go and buy the gun for you and then sell it to you at cost. Consider it a new version of friends with benefits. And consider Joe Manchin a clown. Now, speaking of clowns, there have been a few people who got pretty much retired from the Clown Award because they were repeated winners to the point where it seemed unfair to the other aspirants. Tux Carlson was a good example of that. Well, now we have someone who may well become the quickest retiree ever, Representative Marjorie Taylor Color of Nausea. On March 31st, this bonkers bozo ranted on a Facebook Live video in a way that made some of the QAnon business she spouts seem, well, even vaguely coherent. Sort of, maybe. Anyway, she was reacting to the idea of a vaccine passport, a document that would be carried to prove the bearer had been vaccinated against COVID as a means of, for example, being able to travel without restrictions or gain entry to a concert or some other such event. Now, understand there are legitimate questions that can be raised about these. Privacy advocates, for one, have some serious reservations. But those are sane objections, and so are of no interest to Representative Color of Nausea. Indeed, she said these passports are like Biden's mark of the beast, which in effect labels Joe Biden as the Antichrist of Revelation. Before she went on to rant that it's still fascism or communism, whatever you want to call it, but it's coming from private companies. And here's the good part: I call it corporate communism. So it's fascism. Or except it's communism, except it's capitalism or corporate communism. I know, it's fascist corporate communism. The mark of the clown. All right, we're going to end this with a quickie. Senator John Kennedy of Louisiana, reacting to accounts of proposals from Democrats to raise taxes on the rich, said, and I'm quoting, "Biden wants to allocate the tax responsibility in this country on a basis of class. That's a hell of a way to make tax policy." Senator, that's how it's supposed to be made. The richer you are, the more you pay. That's the whole idea of a graduated income tax. It was even the original idea some centuries ago behind property taxes, the idea being that there is a direct relationship between how rich you are and how much land you own. You know, the original idea behind the Clown Award was that it was given for demonstrating meritorious stupidity. Senator John Kennedy has brought it back to its roots. All right, finally for this time out, we have our outrage. And this one's a bit different because it's not about a single incident or policy. It's about a topic, one I've been meaning to mention at some point. The Electronic Frontier Foundation, which focuses on digital privacy and free speech, reports that during the pandemic, a dangerous business has prospered, invading students' privacy with proctoring software and apps. The group says that in the last year, universities have been compelling students to download apps that collect their face images, driver's license data, and network information. Students who want to move forward with their education are sometimes forced to accept being recorded in their own homes and having the footage reviewed for suspicious behavior. But believe it or not, that's not the outrage here. The thing is, unsurprisingly, students and educators have been pushing back against these invasions of privacy. Last fall, Ian Linkletter, who is a remote learning specialist at the University of British Columbia in Canada, became one of them. Linkletter looked at the university's software actually did and compared it to what Proctorio, the company that sold the spy apps to the university, was telling people about it. He posted some of his criticisms on Twitter and included links to Proctorio's public YouTube videos. So Proctorio sued him, claiming, and I had to admit I read this a couple of times to make sure that they were actually saying this, saying that by linking to publicly viewable YouTube videos, Linkletter had violated both Proctorio's copyright and a confidentiality agreement between the university and the company on the grounds that even though the videos were publicly viewable, they were still actually confidential. Note well, Linkletter did not alter the videos, he didn't reuse them in any way, he didn't even copy them, he just linked to them, but according to Proctorio, that was enough. The case is transparently absurd, but that's not the point. This is why I bring this up, a classic slap. A strategic lawsuit against public participation. A suit not with the goal of winning a judgment, but of silencing a critic by saddling an individual or small group with backbreaking legal costs, aiming to either financially break them or force them to agree to shut up in exchange for having the suit being dropped. Now, fortunately for Linkletter, British Columbia has a sort of anti-slap law, allowing a defendant to bring an early challenge to the suit on the basis that their speech is not a topic of public interest. If the court accepts that characterization, the suit's dismissed, unless the plaintiff in the case can meet a very high standard, allowing it to continue. Dismissal could also result in the defendant getting their legal fees back. Now, this is good, but it's hardly enough. Getting your fees back is not guaranteed first, and in any event, it requires being able to pay them in the first place. Linkletter has had to raise $50,000 to defend himself. And for the corporation, losing a case like this can be written off as a cost of doing business, worth it to silence a critic, and while for the defendant, winning can be bankrupting, spiritually if not financially. Stopping slaps will take more than enabling recovery of costs after the fact. There must be actual penalties to those corporations, including being liable for personal damages, not just legal fees. Slaps have been a weapon wielded by the strong against the weak for some time. In fact, they always remind me of Joni Mitchell's song, Sex Kills, which has the line, "Is justice just ice? Just the strong doing what they can and the weak suffering what they must." They're still being used. But we don't hear about a lot of them because the defendant is often required to never discuss the case as a condition of the suit being dropped. Their purpose is to make the costs of objecting to corporate power too high. It's time we made the cost of silencing speech even higher. For more on this, check out antislap.org. And that's it for this week. We are out of here. I will see you in 2 weeks. You have the best 2 weeks you possibly can. Wear the damn mask. And as always, peace.